Um, well, hello. For those that don't know, I'm Michelle Chadwick. I'm the founder of Hypersomnia Australia, and I'm also the chairperson of Sleep Disorders Australia. Welcome to Hypersomnia Australia's very first Living with Idiopathic Hypersomnia guest series. At times during the year, we'll be inviting special guests on relevant topics with the aim of helping people to better manage living with idiopathic hypersomnia. There'll be two parts to our session tonight. The first will be a presentation and a Q&A. And then after that, we'll have our usual Living with IH catch up for people diagnosed with IH and also parents of minors diagnosed with IH for those of you that would like to stay behind for that. Our first special guest speaker is Jessica Turton. Jessica is a qualified practicing dietitian and nutritionist, PhD student and founder of Ellipse Health. It's important to understand that the message of this presentation isn't that changing your diet will cure IH or indeed that it will guarantee an improvement in your symptoms. The purpose of this presentation will hopefully provide you with information that will help you better understand what good nutrition is and the benefits for overall health and well-being. The aim is to maximise the positive potential of your diet when living with hypersomnia. So there will be a Q&A at the end. So if you have any questions, type them into the chat. Susie is providing Zoom support tonight. So Susie and I will copy your questions and at the end, I'll read them out on your behalf and Jessica can answer them for you. So without further ado, I'll hand you over to Jessica.
Thanks for having me, guys. I will just share my screen. Give me a moment. Okay, we'll make it full screen. All right, can you see my screen? Fabulous, and I'm hoping everyone can hear me okay. Let me know if the audio cuts out or anything like that. But thank you, Michelle. It's great to be here and it's great to be a part of this community. So thanks for having me. As Michelle said, I am an accredited practicing dietitian. And the purpose of this talk is to explore the potential role of diet and nutrition in helping to manage some of the symptoms that you may experience with idiopathic hypersomnia. And there's such a lack of research in this area, and hopefully that changes. Hopefully we get more and more research looking at potential strategies for people living with idiopathic hypersomnia. If you don't know who I am, which I'm sure most of you don't, I'll introduce myself a little bit better. As an accredited practicing dietitian, I work with individuals one-on-one. So people just like you who are looking to improve their health through diet and lifestyle changes. And as the founder of Ellipse Health, we run an online dietetic business. So we consult with individuals all over Australia via Zoom, just like what we're doing now. And we also have multiple practice locations in Sydney where we see people as well. So I've completed my PhD at the University of Sydney. I was investigating the role of low carbohydrate diets specifically for people with diabetes. And I had a focus on type 1 diabetes. Now, I should preface this by saying I don't have any expertise in IH per se, but the process that we use in our clinic is a highly individualized process. So every person that walks in our door, we basically will formulate a personalized dietary intervention for them. You know, we don't have one size fits all guidelines that we give to people based on their condition. It is completely personalized. So no matter what health condition people face or what their health goals are, our process can certainly support them. Now, just to give you a bit of an idea of what that process is, it's something called medical nutrition therapy. So medical nutrition therapy is a process that dietitians are trained in, and it helps us to identify a person's primary nutrition-related problems that are preventing them from better managing their condition, whatever their condition is, or achieving their health goals. And so as part of this process, we collect a very detailed assessment and we get information on a person's medical history, the medications that they're taking, the level of stress that they're under, their physical activity. We look at their weight and their weight history. We look at their blood pressure management. We look in fine detail of their blood test results, particularly nutrient markers, metabolic markers, things like that. We also take signs and symptoms of nutritional deficiency and excess. And of course, as a dietitian, we look at people's diet, what they're eating now, what their dieting history has been over the years, and whether or not they're taking supplements. So all of this information essentially funnels into our assessment, and that's where we can identify someone's primary nutrition related problems. So you can see how this is a highly individualized process. Now, it is a little bit of a misconception that dietitians kind of like hand out the Australian Guide to Healthy Eating. The Australian Guide to Healthy Eating, you've probably seen it before. This is something that, there's posters in schools and in your doctor's office and things like that. And it's basically the public health messaging for a healthy diet. But what we really need to understand about the Australian Guide to Healthy Eating is that it doesn't actually apply to people with medical conditions. And that's because we can acknowledge that people who have medical conditions and people who are experiencing certain issues, they're going to require specialized dietary advice, which essentially just means personalized dietary advice. So I think it's really important to separate that public health messaging from what we as individuals actually need and how we should formulate our own diets. And that's why I love working with individuals, because it's a fantastic way to kind of help people understand what their individual nutrition requirements are and then how to build a diet based on that. So if you notice anything that we talk about today that's inconsistent with these guidelines, that's sort of the reason why. It probably needs to be inconsistent because we're talking about a specific medical condition here. Okay, so here are some symptoms listed on the screen that may be impacted by certain dietary factors. Now, if you or someone you love is experiencing one or more of these symptoms, then it's certainly worth exploring the potential impact that diet may be having on these symptoms, and at the very, very least, excluding the role of dietary factors. Now, what are some of the dietary factors that may be having an impact on these symptoms? So here are some of the main categories. So fluctuations in blood glucose levels is definitely high up there as being a potential factor at play. Blood glucose is essentially another term for the sugar in our blood. And this is something that we all need to be aware of. Even if you don't have diabetes, it still very much relates to you. So we'll talk a little bit more about this today. Another factor is inadequate energy intake. So the whole reason we eat food is to get energy and nutrients, but it's difficult to know how much energy you as an individual need and then how to get that energy through food. And it's definitely a common issue I see in my practice is people actually not giving their body the right type or amount of energy through diet. So we'll talk a little bit more about that today as well. And then the third dietary factor that may be at play is nutrient deficiencies. And there are so many different nutrients that we need to get through our diet each day. And again, it's very difficult to know exactly how much you need and then how to get these through food. And then the other thing that complicates things is each individual has different nutrient requirements. And so it can be a little bit difficult or challenging to understand what your body needs. So of course, working with a healthcare professional is definitely something that's really important here, but I'm hoping I can sort of shed some light on these different dietary factors for you and you can get a better understanding of how they might be impacting you. So let's start with the first one, which is blood glucose fluctuations. Now, our body does like to maintain a pretty tight regulation on our blood glucose levels, but when we eat certain foods, our blood glucose levels are going to rise. So depending on what we've eaten, how much we've eaten, that's going to kind of determine how rapidly and how tall our blood sugar levels increase to. And then anytime our blood sugar levels rise, that's going to be followed by a blood sugar level drop. So your body tries to bring those blood sugar levels back to baseline to maintain that stable glucose concentration. Now, it's when our blood sugar levels are dropping, it's that can sort of, I guess, exacerbate some symptoms that we may already be experiencing, or even cause some symptoms, including things like fatigue, weakness, irritability, and even brain fog. So you can imagine this glucose is kind of like your energy. And if you've got these unstable blood glucose levels that are going up and down across the day, then that is really going to impact your energy throughout the day. The other thing too, blood glucose control is very much tied into a lot of chronic diseases. So unstable blood glucose levels, these highs and these lows, can increase our risk of developing additional health complications. Now, the alternative to these unstable blood sugar levels is these nice flat, stable blood sugar levels. So if we can prevent the blood glucose spikes, then we can help to prevent the blood glucose drops. So instead of roller coaster blood sugars, we can have nice, flat, stable blood sugars. Now, these stable blood sugars can help improve energy, mood, and mental clarity. And it can also reduce our risk of developing additional health complications like those that I mentioned just before. So how does diet impact your blood sugar levels then? This is a very, very simplified graph of the effect of the 3 macronutrients on your blood sugar levels. You can see quite clearly that carbohydrate-based foods have the greatest impact on your blood sugars, so they lead to the greatest rises and the greatest drops. Proteins and fats have more of a stabilizing impact on your blood sugar levels. And so if we're looking to achieve that stable blood sugar, we would be looking to have a lower carbohydrate intake with more healthy proteins and fats. And this doesn't happen to everybody, but most of the time, if we are on a high carbohydrate diet, particularly one that's low in fat and low in protein, we're more likely to experience those kind of rapid changes in blood sugar levels, which might mean we don't feel our best, and it could increase our risk of disease. Now, what are carbohydrates, proteins, and fats? You might have a little bit of an idea already of what foods they are, but let's go through it so you've got a better understanding. So carbohydrates are in a lot of different foods. So most plant-based foods have carbohydrates. So things like grains and cereals and any product from those foods. Fruits and vegetables, particularly starchy vegetables like potato, corn, taro, yam, legumes, that kind of thing. Anything with sugar in it, so carbohydrates includes all starches and all sugars, so that would be natural sugars but also added sugars, so thinking about things like confectionery, biscuits, muesli bars, cereals, and so on. There's absolutely no doubt that carbohydrates are everywhere. And if you're someone who's thinking that this blood sugar fluctuation issue might be a problem for you, and you're thinking, well, if I lower my carbohydrates to improve my blood sugars, what am I going to eat? Because when we go back to that public health messaging, we are generally encouraged to have carbohydrates with every meal. And if you go down the supermarket aisle, you pretty much see carbohydrates in every food product out there. So it can be a little bit daunting to think about, how would I construct my diet if I'm reducing carbohydrates? But that's where the fats come in. So when you're on a lower carbohydrate diet, you want to increase the energy from fats. So as you saw on the previous slide, fats have a stabilizing impact on your blood sugar level. So fats do not increase your blood sugars, they actually help to stabilize it. Fats are a really good source of energy that your body, your brain, your muscles, your nerves, your heart, all your cells in your body can use fats if we don't have as many carbohydrates on board. So what are healthy fats? These would be minimally processed fats, like fats found in fish and meat and avocado, nuts and seeds, olive oil, olives, things like this. If you're a bit confused as to what's a healthy fat versus an unhealthy fat, the way that I like to classify it is by the level of processing. So it's those minimally processed whole foods and the fats contained in those that we typically deem as healthy fats. Now, proteins aren't necessarily a source of energy, and we've kind of ignored them a little bit up until this point. It doesn't really matter what diet you're following, whether it's low carb, low fat, or high carb, high fat, whatever. proteins are absolutely essential. So we need protein with every meal. It's not a source of energy. You would think about protein more like a building block. So protein forms your muscles, your connective tissue, your hormones. It forms your skin, your hair, your nails. And our body is constantly turning over proteins in the body. So getting rid of protein and then putting new protein back in its place. And that protein helps with our immune system and our muscle strength and our bone density and just the general day-to-day function of our bodies. So protein is a priority absolutely no matter what dietary approach you're following. But if you're someone looking to stabilize your blood sugar levels, a lower carbohydrate diet that's higher in fats can help. Now, what does this look like in terms of meals practically? So for breakfast, you could have something like an omelette, some eggs, some cheese, you might add some smoked salmon, you might have some mushrooms or asparagus or a salad on the side. This would be something that would be really nice and filling. It would start your day kind of on a nutrient dense note. There's a lot of nutrients in foods like eggs and salmon, and your blood sugar levels would be nice and stable starting from the very first meal that you have. Lunch could be something like a burger, any burger that you like without the bun. And if you find that a burger without the bun doesn't fill you up, then adding an extra patty, having some salad on the side, putting some cheese in it, some onion, some tomato. So protein-based meals that contain healthy sources of fat. And then a snack in the afternoon could be something like full-fat yogurt, some cream, some berries. Berries are a really good low sugar fruit, and by pairing them with something like full-fat yogurt, for example, you're going to have nice stable blood sugar levels there. And there's a lot of nutrients in these foods like calcium and vitamin C and potassium. And an example for dinner could be something like a salmon fillet with some non-starchy veggies, maybe a bit of butter tossed through that for some healthy fats. And non-starchy veggies are pretty much any vegetable that isn't potato or legumes. And look, this is really just an example day of eating. This is not necessarily something that I would recommend for you. I think it's really important to discuss your unique requirements with a healthcare professional. But this just gives you a bit of an idea of what it could look like to eat a lower carbohydrate diet that has more protein and fat, and then whether or not this helps with your blood sugar control and your energy levels. Now, the second dietary factor to think about is just energy intake. So we've been talking about the type of energy that you put in your body, so carbohydrates or fats. But now we're actually looking at the amount of energy. And I think a lot of people actually forget that the whole reason we eat food is to get energy and nutrients from those foods. And our brain is actually the most energy demanding organ. So even during sleep, we are using a lot of energy. So it's not just people who are physically active that need to think about getting enough energy in each day. It's everyone, because our brains are always using lots of energy. Now, under consuming energy relative to your requirements, that can lead to issues like fatigue or increased risk of illness, brain fog, weakness, etc. When we talk about increasing energy, it's very important to be clear that we're not talking about any source of energy. So the type of energy matters. So if you're looking at the foods on the right-hand side, more of our ultra-processed foods, these things are going to give us short-lived energy. You know, you might get a little burst of energy from having something like this, but over the long term, it can impact your metabolic health and it can leave you feeling lower in energy 60 to 120 minutes later when you have that blood sugar crash. These foods obviously contain refined carbohydrates and refined oils, and they're not necessarily things I would encourage increasing. However, on the left, we've got our minimally processed whole food sources of energy. And these are the things I'm talking about when we talk about increasing our energy intake. So fats from avocado, dairy, fish, meat, nuts, olives, things like that. These are good whole food sources of fat that can give your body lots of energy. And this is a really good way to try and meet your energy requirements by dialing these things up. As we said before, fats have a nice stabilizing impact on our blood sugar levels. So if we need to have more energy without negatively impacting our blood sugar levels, healthy fats are a great option. But how much energy do we need? So we still haven't answered that question. And this is a little bit of a complex conversation because everybody is going to have such unique energy requirements. And we really do need all that information that I was talking about at the beginning to find out how much energy you as an individual need, and then to help you structure a diet around that. So consulting with a dietitian can be really useful. But if you want to kind of get a little bit of an estimate, you can go onto the Eat for Health website, and they do have an energy requirements calculator on there that's free to use. So you can pop in some details like your weight and your height and your age, and estimate your activity levels. And it can give you a bit of an idea as to how much energy you should be consuming each day through your diet. So this is something that we use as dietitians, but then we will adjust it up or down depending on the other information that our client gives us. But if you're unsure where to start, you might like to jump onto that calculator and give it a go. And if you think that you might be someone who's just not meeting your energy requirements through your diet, then it could be worth having a chat with a dietitian to find out. Nutrient deficiencies are another factor that can greatly impact those symptoms that we were talking about before. These are just 3 of some of the nutrient deficiencies that I see most commonly in my practice, but there's many, many more. Most people will probably know about iron deficiency. It's very common, and a lot of doctors often check for iron. Iron deficiency can lead to symptoms like fatigue, headaches. It can weaken your immune system. And if nothing's done to treat the iron deficiency, it can lead to anemia, where we have a lack of oxygen being carried around the body. And that's definitely going to make you feel pretty terrible. Now, iron is found in animal foods, particularly red meat. Certain types of fish contain iron, like sardines. And organ meats are very high in iron, so things like liver. There is some iron in plant-based food, but it's non-heme iron, so you have to eat a lot more of it to get that iron status. And non-heme iron sources would include things that people are aware of, like spinach. Now, it's a really, really good idea to actually get your iron levels tested regularly if that's not already something that you do. Women in particular have quite a high iron requirements, and it can be very, very difficult to meet these with diet. And then some people as well have poor iron absorption. So you might be eating a lot of red meat, eating a lot of spinach, having a lot of iron-rich foods, but your iron levels in the blood can still appear low because your body's not absorbing it. So there's quite a lot to think about with these nutrients. But if you're not already eating those iron-rich foods, perhaps you can think about dialing them up. Now, another nutrient to think about is vitamin B12. Vitamin B12 is a tricky one because it's very, very hard to absorb vitamin B12. So there's so many things in your digestive tract which need to be working in immaculate order for you to absorb B12. And the slightest bit of stress or a certain medication can actually reduce your absorption of this nutrient. So this is a really, really important one to keep an eye on and to have tested regularly if you're not already. And vitamin B12, it affects the nervous system. So you can think about B12, it forms the cushion around all of your nerves that go from your brain to different parts of your body. And when our body starts to get lower in B12, we stop sending it to the cushions in our nerves, and those nerves can quite literally break down. Sounds a little bit scary, but it's something that is unfortunately very, very common, and it can lead to symptoms like brain fog or even cognitive impairment. It can lead to mental health issues like anxiety. It can increase symptoms like dizziness or vertigo. And if you have any nerve damage in your peripheries, so your hands or your feet, you can get some tingling or numbness or pain. Vitamin B12 is a common deficiency, and it can be quite hard to pick up as well. So if you're experiencing any of those symptoms, it's definitely worth getting that deficiency investigated. Now, the food sources of vitamin B12 are actually quite similar to iron. So we find vitamin B12 in animal-based protein foods, so things like meat, fish, and dairy. Seafood is also a really good source of B12. Now, there's no B12 naturally present in plant foods, but some companies do fortify their food with the B12. So there's tofu and meat alternatives and certain cereals that are fortified with B12. Vitamin D is another very common one. Vitamin D is a nutrient that, of course, we get from the sun. Most people know that. And depending on your skin tone and skin type, you're going to need a different amount of sunlight each day to meet your vitamin D requirements. Now, when we're low in vitamin D, that can lead to low energy. It can also affect our mood, and it does have a big impact on your immune system. So oftentimes when we see people diagnosed with autoimmune issues, or they have quite severe viral infections, or they have poor recovery from viruses, we often find that this coincides with a low vitamin D level. And it's really, really important to understand what skin type you have and how much sunlight you need on a regular basis to help maintain vitamin D. The other cool thing about the sun itself is it helps to boost serotonin. So serotonin is the neurotransmitter that peaks during the day, and then that serotonin helps to produce melatonin at night. So it can have a positive impact on our neurotransmitters as well. Now, if you are someone who does have a regular GP, your GP might already be testing nutrient markers in the blood. Here are some examples of some nutrient markers that are really good to ask your GP for if they're not already doing them. Getting these tested in the blood can give you quite an accurate picture of your dietary intake and whether or not that's sufficient. One thing to say about these nutrient markers, however, is there's a big difference between being in the normal range and being in the optimal range. So if we take iron for an example, there's a marker on your blood test called ferritin, which would be part of the iron studies. Ferritin is your storage of iron, and the reference range is usually about 30 to 300. That's a very broad reference range. So you could be sneaking in there at maybe 35, and then your doctor might say everything's fine, everything's in the normal ranges. But what we find is that people who sit on the lower end of the reference range, particularly for nutrients like iron, can still be experiencing symptoms of deficiency. So what we really want to be aiming for with these nutrient markers is to get into that optimal range. So we don't want to be sitting close to the low end of the reference range. A good rule of thumb is to try and be somewhere in the middle or towards the top of the reference range. And usually that is the optimal range. The other thing to think about is there are other nutrients that you can't actually get an accurate test for in the blood. So these are things like sodium, magnesium, potassium, calcium, vitamin C, omega-3 fats. These nutrients are too really, really important for our energy levels and our mood, our capacity, brain capacity, and our quality of life. But assessing these in the blood doesn't always really give us a good reflection of how much we're getting in our diet and whether or not it's optimal. If we take the electrolytes, for example, so sodium, magnesium, and potassium, these are very tightly regulated in our blood. And let's say we're not getting enough of these nutrients in our diet, what our body can actually do is pull these nutrients from the bone, put them back in the blood. So if you get your sodium levels tested, for example, or your calcium levels tested, they are 99.9% of the time always going to be normal, even if you haven't eaten calcium that day, or even if you hadn't had sodium that day. And that's because your body will pull those nutrients from its stores to put them in the blood, because it's so important to have these nutrients in the blood. So we actually assess people's signs and symptoms. So that's how we figure out whether or not people are meeting their requirements for these nutrients. We look to see if they're experiencing signs and symptoms of deficiency. And then we also assess their diet, of course, to see how much they're getting in that way. So it is a little bit confusing, but I think it's just something to be aware of. And some of you might already have a really fantastic GP who's monitoring a lot of these things. Some of you might already be working with a dietitian and optimizing your nutrient intake. But nutrient deficiencies and insufficiencies are some of the biggest problems we see in clinic, no matter someone's health condition. And you certainly don't want these nutrient deficiencies to be making your health condition worse. Now, if you are interested in exploring the role of diet further, then there's definitely more information on our website. So we have a lot of free articles on there, a lot of videos and presentations that you can watch if you want more information. Seeing as I did my PhD in low carbohydrate diets, if that's something that interests you, we have a lot of presentations and videos that go into detail on how you can build a low carbohydrate diet if that's something that you think might be useful. But we obviously also offer personalized dietary consults. So if you're a bit sure about your individual requirements and what you should be doing with your diet, then I definitely recommend getting some individualized advice on that. And I also teamed up with Dr. Pran Yoganathan, who is a gastroenterologist in Sydney. And he and I wrote an ebook all about getting started with a low carbohydrate diet. But we didn't just focus on carbohydrates, proteins, and fats. We actually focused on all the things we've spoken about today. So helping people develop their diet in such a way where they are getting the right amount of energy, and also helping people develop their diet and structure their diet in such a way where they are getting those micronutrients. And so there's a lot of information in there that could be useful and relevant to you. And that's all. Thank you. You're on mute, Michelle.
Yeah, thank you very much, Jessica. That was fantastic, and I'm sure that you have given our community something to think about, and I'm sure that I'm just looking at another question. Got some questions here for you. The first one is from Amanda, who says, who do we believe? So how do we sort one lot of nutritional advice from another? Does it change based on age or other chronic health conditions? So salt versus salt, fasting versus smaller meals more often, low carb versus national dietary guidelines. How do we know what is best for us?
It's such a confusing topic because, you know, everywhere you read, there's different information. And so like if you're going onto Instagram, looking at different healthcare professionals, if you're going onto the public health recommendations, if you're talking to a particular practitioner, everybody does have different recommendations. So it is a bit hard to answer that question, but I can sort of shed some light on it. And I think, you know, one thing that's really, really important to remember is what I said before about that public health messaging and the public health guidelines. And we need to understand that all the studies that went into developing those guidelines were done on very, very healthy people that didn't have any risk of chronic disease. They didn't have any nutrient deficiency. They had no medical conditions. And to be honest, these type of people don't really exist today, right? Like usually we have at least one, maybe more chronic conditions that we're dealing with, or we have a risk factor for a chronic condition, or we have a nutrient deficiency or something that means we don't quite fit that healthy person category where those public health messages apply. And it can be very confusing because when you see something on TV, or even sometimes when your healthcare professional says something to you, or when you read something online, sometimes they're pretty much just regurgitating this public health messaging, which is a low-fat diet, eat less meat, cut out, fat off your meat, don't have butter, eat lots of whole grains. And that messaging is not necessarily for people with specialized medical conditions. So I think that's the first thing to sort of think about. I always tell my patients that when you read something online, when you see a particular recommendation, or if your friend tells you they're doing something, write it down and then come back in and we'll have a chat about it, and we'll see if that particular recommendation or piece of information applies to you. But the reason we see so much inconsistent information is because everybody has different nutrient requirements. And I think we just have to remember what works for one person doesn't necessarily work for another. And in this particular field, we don't really have any research on diet and idiopathic hypersomnia. There is a lot more research in conditions like type 2 diabetes and obesity and the metabolic syndrome. And so when we have patients coming into our doors with those particular conditions, it's very much clear in the literature that a low carbohydrate, high fat, good quality protein diet is the best approach. But even then, we have to kind of talk to the patient and find out, is that achievable? Are they going to enjoy that? Are they going to sustain that long term? Can we practically implement it into their diet? So we have to look at the science, but we also have to talk to the patient and find out what they want to do.
Okay, Susie has a question. Do you have any advice on finding a balance between different recommendations? Oh, sorry, that's already been asked. But more, Susie's question was more with regards to eating more red meat for iron, but eating less red meat as it's pro-inflammatory. So where do you find the balance?
Well, you really have to look at the evidence behind these claims. So for example, there is a lot of claims made that red meat is quote unquote inflammatory, it increases our risk of cancer and heart disease. But when you actually go and look at the studies, you'll find that it was not a causal link. So what they did was these big epidemiological studies where they essentially got hundreds and thousands of people. They gave them a questionnaire, and in that questionnaire, they had to tick how many times they had sausage rolls, meat pies, party pies, steak, all that sort of stuff. So they're recalling their diet on a questionnaire. And then basically what the researchers will do is they'll follow these individuals up 20 years later, 30 years later, find out who gets cancer, find out who has a heart attack. And then they start correlating, well, these people had the most heart attacks and they ate the most red meat. So therefore red meat increases your risk of heart disease. So that's okay, we need that sort of science. But then what should happen is researchers come along and they do a randomized controlled trial or a clinical trial to actually identify or investigate whether or not that potential association was actually causal. And one thing that we know, if we're talking about red meat, is there is not one single clinical trial that does show minimally processed red meat is linked to disease. And if we're talking just about type 2 diabetes is, one of the biggest epidemics that we face in our population. And it's the main cause of cancer and heart disease. And all the studies that show reversal of type 2 or improved management of type 2, they actually included red meat as the base of their diet. So none of those studies restricted or limited red meat. And we know that glycemic control improved, so that's blood sugar stability. Their risk of heart disease went down. And in a lot of cases, they were able to reverse their diabetes. So I think we definitely need to look at the evidence behind these claims. And sometimes that does mean speaking to a healthcare professional who can do that for you, because it's hard to do that if you don't understand the evidence, I suppose.
Great. So what are some options to replace sweet foods? Do you have any suggestions for that, for our sweet tooth?
Yeah. So I guess there's a few things at play here. If you are, trying to stabilize your blood sugar levels and follow a low carbohydrate diet, then yes, sugar is going to work against you with that goal. And some things that you can do instead of sugar would be using natural sweeteners. So when it comes to sweeteners, there's different categories. We have artificial sweeteners and we have natural sweeteners. So natural sweeteners are things like stevia, you may have heard of that, erythritol, monk fruit, and things like xylitol. So they're basically sweeteners that they've pulled from different foods, but these sweeteners don't have an impact on your blood sugar levels. So you can add them to your diet without your blood sugar levels changing. Whereas if you ate sugar or something like sugar, then your blood sugar levels are definitely going to increase. But the other thing I would think about, apart from just swapping sugar with a natural sweetener, you also want to be asking yourself, well, how often am I having these sweet cravings? What is the cause of this sweet craving? Because quite often those blood sugar fluctuations that I was talking about before can be the cause of the sweet craving. So you might want to ask yourself, what was my previous meal? You know, what did I eat for breakfast or what did I eat for lunch leading up to the time where I get that sweet craving? Perhaps your previous meal didn't have enough healthy fats or it didn't have enough protein. And you might actually find next time you build those main meals, try increasing the proteins and fats and see if that actually diminished the craving that you get maybe 3 p.m. in the afternoon or whenever it may be. So I'm not saying that we need to deny sweet treats at all. I understand that a lot of people love to enjoy a sweet treat every now and then, but I think it's also good to ask yourselves, is that a symptom of me actually not fueling myself properly before that?
Yeah, I definitely can relate to that. Since reducing my carbs and sugar intake, I now don't have the sugar craving near as badly. I think getting over the sugar addiction was probably the best thing that I could have done for my overall health. We've got another question with regards to your thoughts on protein powders or keratin or other supplements. Do you think that taking vitamins as well is something that you would advise, or are they just a waste of money?
I don't think they're a waste of money if you know you actually need it. So, if we just start with protein powders, I mean, we know we need protein. So, I said it before, it doesn't matter what diet you're on, we need protein. Now, obviously, we can get protein through food, and that's going to give us micronutrients as well. So, there's benefits to having food sources of protein. But let's say you're really time poor. Like if you're really time poor and you're struggling to cook a high protein meal, or maybe your appetite's a little bit low, but you know you should eat something because you haven't eaten for a while, then protein powder can be kind of useful, right? Because it gives you that protein, which is the building block your body does need. But it's just I guess you want to be going for like a good quality protein powder. And all I mean by that is looking at the ingredients list and seeing what else is in there. So a lot of the times we get the protein, but we also get added sugars or we get artificial flavors or other things like that, which might negatively impact our energy and might negatively impact our health. So it's relatively easy to just get a pure whey protein powder or a pure collagen powder with nothing else added. And then if you added that to a smoothie, for example, where you might put in some like nut butter, you might put in some milk, you might put in some yogurt, you might put in some blueberries, and then you've got your protein powder. Yes, I think that can make a really good meal for people, especially if they're time poor and they don't want to cook. And then in terms of like vitamins and mineral supplements, we use these in our practice for people who have very high nutrient requirements. So people that are under quite significant amounts of stress, which is a lot of people, they need high amounts of magnesium, for example. They also need high amounts of B vitamins. And we can really formulate the diet in quite a specific way to get a lot of these nutrients. But if people are under these really chronic high levels of stress, sometimes we just can't eat enough food to meet their nutrient requirements. And for a period of time, they may benefit from a magnesium supplement or some B vitamins. And then the other thing to think about is if people are taking medications. So there's a lot of medications that actually reduce your absorption of nutrients in the gut. So you might have this beautiful diet with all of these nutrients, you're eating lots of nutrient-dense foods, but then you're taking medications that affect your digestion and you're not actually properly absorbing these nutrients, and then they can be low in the blood. And so when we see people on multiple medications, we may do some supplements. And then if they ever come off those medications, then we can come off the supplements.
Okay, just another one here. I have chronic pain and low energy focus, and I struggle to cook for my family. Where can I source quick, easy, healthy choices which require less cooking and more assembling? So is there a shortcut?
Well, look, it's definitely going to depend on individual situations, but I mean, I myself, I'm not a chef, I'm not a cook, I don't like following recipes. I literally throw together foods and all of my meals are done in under 10 minutes. And a lot of patients want that. So it's more just about giving you the right ideas, really simple meal ideas, and showing you what to buy from the supermarket that's going to make your life as easy as possible. In the ebook that I just showed you before, it's on our website, we have a heap of those simple meal ideas. So if you're really struggling to come up with meals for you and your family, and you're trying to keep inflammation levels really nice and low, could be a good idea to have a look at some of those meals. Simply because, you know, I don't like giving patients big to-do lists, you know, like I don't want to give them all these recipes and tell them to buy all these ingredients that are going to be really complicated. Some patients love that, you know, some patients have a lot of skill in the kitchen, but most of the time people are time poor and they need something simple. So I 100% agree. We can still eat healthy, minimally processed foods if we are time poor. It's still possible, but we just need help structuring that. And the other thing that we do sometimes for our patients is link them into meal delivery services. So actually across Australia, we have a lot of really good meal delivery services. So you might be really stuck at lunchtime, for example, and you might want to get meals delivered just to help you at lunch. Or you might be really stuck at breakfast or really stuck at dinner, or you might be a single person that doesn't have to cook for a family and you don't want to cook all these big extravagant meals. You just want to look after your own meals, and meal delivery services can be useful. So I don't necessarily think there's a shortcut, but I do think that with planning, we can make it work even for people who are time poor and for people on a budget.
Okay. What are your thoughts on meal sizes and meal frequencies? Is intermittent fasting something that can be helpful?
Yeah, definitely. I think if you've got metabolic issues, so if you're overweight, or you've got diabetes, or you've got high blood pressure, if you've got fatty liver, then actually having less meals but larger size meals can be really useful. So that time period between the meal is usually when your body is burning fat. So if you are following a lower carbohydrate, higher protein, higher fat diet, the time between the meal, your body is just happily burning fat. And so if we have blood glucose dysregulation or excess weight, things like that, that can be really, really useful. Now, the thing you have to balance that out with, though, is your energy levels. So some people kind of fall into the trap of only eating 1 or 2 meals a day because they're just so desperately trying to lose weight, but then their energy levels start to drop because they're just not meeting their energy requirements. And so if you are only having 1 or 2 meals a day, you actually need to make sure the meal size is pretty big. And I usually recommend, if we're looking at whole foods, I usually recommend my patients eat those to satiety. So especially those healthy forms of protein and fat, eat them to satiety, whatever that means to you. And if you really tune into satiety, you'll give your body the nutrients and energy it needs. But that only works with minimally processed whole foods. You know, if you eat ice cream to satiety, if you eat cookies to satiety, you're going to overeat those things because your body doesn't necessarily recognize when satiety is for those foods. But for minimally processed whole foods, your body is great at figuring out how much you need. So we definitely need to trust it. Now, do you need to do intermittent fasting? Do you need to reduce the frequency of your meals? Again, that's going to depend on what your health goals are. But I definitely think in this group, with our energy levels being a priority, you just need to be careful. If you do reduce your meal frequency, make sure your energy doesn't drop, because that means you're not getting enough energy through your diet.
Okay. This is a good question, actually. Can you give us a rough idea of the time frame to expect from switching to a low carb diet to adjusting and feeling better? Is there the same time frame, or what can affect how quickly you can start to feel better after lowering your carb intake?
Yeah, so it's a good question, and it sort of highlights the fact that, you know, when we are on a low carb diet, our body uses fat for energy. When we're on a high carb diet, our body uses carbohydrate for energy. And most people are following a higher carbohydrate diet because that's what the public health messaging says. Carbohydrates are everywhere. So your body is very much used to using carbohydrates for energy. When you go on a low carb diet, you pretty much take away your body's main source of energy. So there certainly is a transition period where your body's trying to figure out this new source of fuel you want to burn. And there can be about a 2 to 3 week period where you're not actually feeling your best because you've taken away that main source of energy. You're trying to give it this new energy, which is fat, but there is an adaptation phase where your body is increasing enzymes to burn fat and metabolize fat. And you're also changing digestive enzymes in the gut to suit your new diet. So I would say about 2 to 3 weeks. But we also can implement strategies to reduce that time frame. And it also does depend on someone's metabolic health. So if you're particularly healthy in terms of the fact you don't have diabetes, or you don't have issues with weight, you don't have high blood pressure, you'll actually find the transition is a little bit quicker because you don't have that insulin resistance that you have to deal with. But if you do have those insulin resistance related issues, the transition's a bit slower. But my tips during that transition period is just to make sure you are eating plenty of fat, because your body will not be able to tap into stored fat in that transition phase. It doesn't know how to, especially if you've got insulin resistance. So you really need to be bringing in the fats from the diet to fuel your brain and prevent those feelings of fatigue and other issues that can happen while you're transitioning over.
Okay, great. I think you covered this during this is a question that came on fairly early, and I think you did actually cover it in the presentation. But just so that we're clear, do you have any strategies for reducing frequent low blood sugars? A lot of us have crashes in the late afternoon, and would like to know how we can prevent that. And I think that basically, if we keep our carbs low and eat a lot of fat and protein, that's the answer. But it would be great to hear if you have any strategies for that.
Yeah, so the only reason you will get low blood sugars if it's followed by a high blood sugar. So if we want to prevent the lows, we need to prevent the highs. And as we said, we know that what contributes to the high most likely is going to be carbohydrate. But there are other things that can contribute to high blood sugars. So something we haven't spoken about yet, which is very, very common, is stress. So when stress increases, your body is going to make more cortisol, and that means you make glucose. So your glucose levels can rise because you're stressed. You may not have eaten any carbohydrate. And then your body has to release that hormone insulin to bring your blood sugars down. And sometimes your body releases a lot of insulin to do that, and your blood sugars can be pulled down too low. So it can certainly happen after stress. It can certainly happen after a higher carbohydrate meal. And so in terms of when you are actively experiencing low blood sugar, what do you do? So if you're just feeling really crappy, you know your blood sugar's low, you can't turn back time and change that stressful event or whatever you had to eat, the best thing you can do is provide your body with that alternative source of energy. Because what's happening when your blood sugar is low, your insulin is high and your blood sugar is low because your blood sugar has just dropped. So you've run out of energy from glucose, and your insulin is high, which prevents your body from burning stored fat. So the only option you have is to actually add fat to your diet at that point to give your brain some energy. Otherwise, your stress hormones just kick in again to bring your blood sugar levels back up. So you can be riding this little roller coaster of stress. And so to break that roller coaster, to break that cycle, to stabilize your blood sugars again, think about having some of those healthy fats. And then also consider, if that's happening regularly to you, consider working with someone to actually identify what it is that's affecting your blood sugars, because it's different from person to person, and different amounts of carbohydrate and different types of stress are going to affect people differently. So you might need to do a little bit of an investigation with a healthcare professional.
Right. Okay, that's great. If we don't have any more questions, I think we'll wrap that up. If anyone does have any questions that might come to them later, which is typical for us, if you're getting a little bit mentally fatigued at the moment, but a question pops into your mind later, by all means, email me and I will make sure that your questions do get answered. I would like to thank Jessica again for coming along and giving this presentation. We very much appreciate it. We've had many of these questions amongst ourselves, and it's great to have somebody with your experience that can answer them for us. So thank you very much for coming along and speaking to us.
That's all right. Thanks for having me, Michelle. And I had my email on the screen, so if anyone wants to
Yeah.
email me directly, they're more than welcome to do so. I'd be happy to help.
Oh, that's great. That's fantastic. Thank you very much.
No worries.
Okay, bye.
Enjoy the rest of the meeting, guys. See you later.
Yeah, I will. Thank you. Okay, Susie, you can turn the recording off now.